Doctor visits are already expensive, but now some patients are facing something new: annual administrative fees, typically $50 to $250 a year, just to stay with their doctor.
That's a lot of money that starts to add up.
Amber Rodriguez is a producer at NBC4. She started getting hit with administrative fees, a $50 yearly fee from her gynecologist, another $120 fee from her primary care doctor. And when she asked what it was for, the explanation, she says, left her confused.
This is, it's not covered by your insurance. We need to, charge this to stay afloat.
Doctors we spoke with say the administrative fees that patients are seeing are to cover for cost in their health care that is non-billable by insurance. Things like filling out lengthy insurance claims, prescription refills, prior authorizations, basically all the work in the background we don't see.
Desktop medicine is a large portion of a healthcare provider's practice, and that portion is not reimbursed. Hence why a lot of practices have had no choice but to lean on these administrative fees. And even with those administrative fees, it still isn't covering the complete gap.
It does increasingly take a certain type of specialized background in order to even bill nowadays. And the costs reflect that.
Caitlin Donovan with the Patient Advocate Foundation says for some patients, these fees just make it harder to predict what care is going to actually cost. And some, they fear, will just stop going to their doctor altogether.
And a lot of patients not only give up and not go to their doctor's appointments, but they kind of lose faith in the system, and it builds this distrust.
When it comes to administrative fees, there are some ways providers can get compensated. In a statement to News 4, the American Health Insurance Plans, a national trade association representing health insurance plans, says there are existing reimbursement structures that reflect providers' overhead costs, such as clinical staff time, supplies, equipment, and administrative functions, including filing claims. That raises the question to patients like Amber: if providers are already being reimbursed for overhead, why are patients now being charged separately for administrative fees?
Healthcare has changed so much in the past decade in terms of, particularly with electronic medical records, also with increased cost of living. So it's more dynamic, it's more costly. So medical officers are doing the best they can to really just keep the lights on, provide for their staffs, and provide access to their patients.
The health insurance industry acknowledges there is a shared responsibility to improve a system that they say is outdated, causing frustration for patients and providers. For now, though, experts say just ask your doctor up front about these fees, and if you can afford it, ask for a waiver.
Now, these administrative fees are not the same as facility fees. Those are tied to hospital groups and billed when you see a provider connected to a hospital. These fees are not paid by insurance. However, you may be able to pay using your FSA or HSA. But of course, check first. Back to you.